afternoon, everyone. My name is Caitlin, and I am a pharmacy resident here at Sarasota Memorial Hospital. And today I'm excited to talk to you all about how you can improve your sleep. So some of the things I'd like to highlight today are, I'd like to define insomnia and talk about what it is, what some of the signs and symptoms are of insomnia, talk about some factors which can increase your risk of having insomnia. Also identify some ways that we can manage insomnia, as well as some of the side effects and adverse effects that can come along with some of the ways that we tend to manage insomnia. To start things off, insomnia can be described in different manners. So it can be described as having trouble falling asleep. It can be described as having trouble staying asleep. You could be woken up multiple times during the night, or you could just have a hard time staying asleep for long periods of time. And these tend to lead overall to daytime dysfunction. So 30 to 50% of patients living with cancer tend to experience sleep disturbances, and this is quite a difference from our average population. Among them, the highest prevalence is in those with breast cancer. And so what's the problem with insomnia? What's the problem with losing sleep? And the biggest concerns is that we tend to see an increase in things like high blood pressure, also known as hypertension. We see an increase in accidents, learning problems, and also mood disturbances. So other than cancer, there are a few other things that can increase your risk of having insomnia. One of them is being a female. So women are more likely to have insomnia in comparison to males. In addition, as you get older in age, our older population tends to have an increased rate of insomnia. Then if you have a family history of insomnia, if your parents have insomnia, that can definitely increase your risk of having it as well. And then also just if you're a light sleeper. So being a light sleeper can put you at risk. I'll talk a little bit more about how these kind of all play into the role of insomnia, but in order to do that, we'll first talk about the normal sleep and how that should occur. So the picture in front of you describes a sleep cycle. So basically, the average adult should get between 7 to 9 hours of sleep on average. During that 7 to 9 hours, your body goes through what's called a cycle, and the cycle is made up of these different stages. So during the night, you go through 4 to 6 cycles. Each cycle is 90 to 110 minutes long. And what that means is during one cycle, your body goes through stage 1, which is the time that it takes you to fall asleep. Then stage 2, you're actually asleep. But stage 1 and 2 put together all is called light sleep. It's kind of, as we imagine, light sleeping. And so as you progress into stages 3 and 4, this is your deeper sleep. This is when your heart tends to slow down a little bit, your breathing slows down, and your body's fully still and rested. As you continue, you get to stage 5, which is what we call our REM sleep, or also called our rapid eye movement sleep, because quite frankly, your eyes move during this part of sleep. And the interesting part is that during this part of your sleep, your brain is quite active, and people tend to have vivid dreams during this time. And as I mentioned, the average adult should get 7 to 9 hours of sleep. And on average, the American adult gets 6.9 hours per night. And of that, we should really get 4 to 5 hours of that deep sleep, those stages 3 and 4 that I talked about. And as we age, not only does the amount of sleep that we need change, but also the type of sleep that we tend to get changes. And so I've shown up here that as you become older, our elderly population tends to experience a decrease in that stage 3, 4 deep sleep, which can be problematic. In comparison to, say, an infant, where their sleep cycle is quite different because they spend half of their time in REM sleep. So you can see as you go through different age frames that your sleep structure kind of changes. Now, what can go wrong in all of this? Why are people not sleeping? So I've listed some common reasons here up on the slide for you. And so these are all things that contribute to insomnia, but the big thing is your sleep habits, which is something we're going to talk about for sure. But this can be as little as what time you go to bed or what you're doing around the time that you go to sleep can definitely cause issues when it comes to falling asleep or staying asleep. Also your medications. So we tend to take a lot of medications to help our health conditions, but the interesting fact is that medications can also cause a lot of harms in our life as well. And so one of them is that it can prevent you from falling asleep at times depending on the medication. Other health issues. So we talked a bit about cancer, and we'll talk a bit more, but remember, before you had that diagnosis of cancer, you also had all of these underlying conditions before that. You may have had high blood pressure already, you may have had other conditions, and those are also contributing to your insomnia. Stress. So if you find yourself laying in bed at night with your mind racing a mile a minute, stress may be preventing you from a full night's sleep. And then lastly, sleep environment. So this can be your bedding or the lighting in your room. Definitely plays a big role. And so we'll talk more about these. So disease states overall can cause issues with sleep. So if we refer to congested heart failure, for example, is also known as CHF, this can get worse when you're laying down at night, and patients can become symptomatic during that time, preventing them to sleep. COPD is a chronic pulmonary lung disease, and that can definitely cause symptoms during that time and prevent you from sleeping. But also, some of the medications used to treat COPD are steroids, which are a big contributor to loss of sleep. Chronic pain. So it might be obvious that if you have chronic pain, this can definitely cause an issue when it comes to sleeping. However, it might be as simple as, if that's what's preventing you from sleeping, maybe we need to address your pain management. So these can also help guide the way we treat. Depression and anxiety. So the interesting thing about this is that insomnia or lack of sleep, and also hypersomnia or increased sleep, are symptoms of depression and anxiety. So it is possible that if we can manage these two conditions, your sleep could improve right off the bat. And then there's also contributors, like we mentioned, high blood pressure and diabetes. So if you have a history of diabetes, maybe it's peripheral neuropathy or numbness and tingling in your fingers and hands that keep you awake at night. Sleep apnea occurs essentially when your body almost forgets to breathe for a couple seconds during the night, and that can definitely affect your quality of sleep. And then restless leg syndrome is when essentially you lay down at night and you have the inability to sit still, and you feel the urge to move your limbs, and you can imagine how that can be burdensome when you're trying to rest. So specifically related to cancer, we talked about how cancer can increase your risk of having insomnia. However, there are certain aspects of cancer which definitely contribute to this overall. And so we already talked about anxiety. So having a diagnosis like cancer, there's a lot of uncertainty of where things are going, what new patient regimens you might need to be on. You might be concerned about having many doctor's appointments. These are all stressors that can lead to, like I said, staying up with your mind racing at night, preventing you from sleeping. You may have family or social issues on top of this again. So maybe this requires you to, again, get to doctor's appointments, and maybe you have transportation issues, or maybe you're going through conflicts with your family as a result of what's going on in your life. Maybe you have financial concerns. These are big stressors that can come along with your diagnosis. We already talked a little bit about pain, but the diagnosis of pain can come along with painful symptoms, and that's definitely something that should not be ignored overall, but especially if it's preventing you from sleeping, we need to address that first. Medication side effects. So some of the different chemotherapy regimens can cause side effects which can prevent you from sleep. So one of the more obvious ones is that it can make you drowsy during the day. Now, if you're resting too much during the day, that can cause you from not feeling tired at night. There's also side effects, as many people will know, that many of these drugs can cause nausea and things that are very uncomfortable when you're laying down at night, and that can prevent sleep. And I talked a little bit about restless leg syndrome, but the fun fact that I wanted to mention was that the prevalence or the risk of having restless leg syndrome is doubled in patients that are on chemotherapy regimens. So other than chemotherapy, there's other medications as well that can definitely contribute to lack of sleep. And so an obvious one is stimulants. And so this can be like caffeine. And most people know that it's best not to drink caffeine before bed. And this is why, because it can keep you up. And other stimulants can be medications used to treat ADHD, so things like amphetamine, that can definitely keep you awake. Antidepressants. So antidepressants are interesting because it depends on the antidepressant. So while some antidepressants may make you drowsy and may help you sleep, others can keep you awake. So it depends on the medication that we're using. Nasal decongestions like Sudafed, those are definitely medications that can play a role. There's some blood pressure medications and water pills. So if you think about a water pill as something we also call as a diuretic. Now if you take this before bed and you're having to get up constantly during the night to use the restroom and to urinate, that can definitely prevent you from resting and sleeping through the night. So I mentioned briefly before, but steroids, so things like prednisone, these medications actually work kind of like a natural hormone in your body that is increased when you're awakened in the morning. So you can imagine if that hormone's increased in the evening, it's going to prevent you from falling asleep. Some Alzheimer's medications can be very activating. We talked about caffeine. And alcohol I want to touch on because many people think that alcohol helps them fall asleep. And the interesting thing when it comes to alcohol is that it can help you fall asleep, but then those effects tend to wear off quickly, and then it can actually wake you back up and prevent you from sleeping through the full night and can definitely cause problems with your sleep duration. Tobacco products are activating, so we definitely wouldn't recommend for you to smoke at all, but if you're going to smoke, we wouldn't recommend for it to be in the evening before bed. Now these are some of the things we can do if you have these issues and you have these contributors. So I'm going to talk more about these, but I wanted to briefly mention sleep hygiene is the biggest thing that we would do to intervene if you have sleep problems. And this basically means your sleep habits. So we'll talk more about how you can improve your sleep habits in order to prevent insomnia. Then we have herbal supplements and over-the-counter products that are available. And then lastly, we have prescription medications. So this starts things off with talking about sleep habits. And I have listed some up here, some of the basic rules for better sleep. And the interesting thing is that about 70 to 80% of patients will actually see improved sleep without any use of any medication. And so just by improving their sleep habits. So some things that you're going to want to do, you want to keep and maintain a sleep schedule. So it's best if you can try to go to sleep at the same time every night and wake up at the same time in the morning. And that will keep your sleep cycle regular and help you sleep through the night. Exercise is definitely a big thing. So you should definitely talk to your doctor about what exercise is recommended for you and your body. However, exercise can definitely help you sleep. The interesting thing now with exercise is that you want to exercise maybe earlier in the afternoon, because if you tend to exercise right before bed, you'll be very awake and it'll be hard for you to fall asleep. We want you to make your bedroom comfortable. So if it's something like an uncomfortable mattress, that can keep you awake. And also minimize disruptions. So if you live with family members, let them know that when you're trying to rest, or try to minimize the amount of times that you have to get up or be awoken. Some patients benefit from relaxation techniques and meditation. Those can definitely be great help with falling asleep and staying asleep. And then lastly, we want to power down our devices during this time, and I'll talk a little bit more about that. Things to avoid: daytime naps. So again, the more you sleep during the day, while it may be appropriate with your health conditions for you to rest during the day, definitely talk about it with your doctor, because if you sleep too much, that can definitely cause problems in your sleep cycle. Large meals or large fatty meals around bed, so when you're digesting, that can keep your body awake and definitely prevent you from falling asleep. So try to either, if you're a late night snacker, maybe try to have a small snack that's low in fats, or just try to eat your meals earlier in the evening. And we talked about avoiding stimulants. So again, we don't want any type of caffeine, tobacco products around the time that you're going to bed. And avoiding alcohol is big. The last thing I'm going to mention is that it's really important to use your bed for sleep and intimacy. So that means we want you to avoid associating your bed with some of the things you're staying up to do, like reading or watching television, eating, playing on your phone. These are things that if you're still awake and you're doing these things, try to do them in another room. Try to move out to the living room or to the dining room to do these things. I touched on sleep environment, but I wanted to give you all a little bit more information. So having your bedroom and your bed comfortable can definitely help you sleep better. And so it's important to have the temperature in the room at a temperature that's comfortable for you. So they recommend 60 to 72 degrees Fahrenheit, but if you want to do what's best for you and your body. Turning off the lights. So actually, when you turn on the lights, your body releases a natural hormone called melatonin, which helps you relax and fall asleep. So if you have light in the room, that can be preventing that from happening. And so if you have some unnecessary lights, it may be helpful to get blackout curtains, or if you even need an eye mask, anything to take down the lights. Similarly, noise can keep you awake. So if you feel the need, you can get earplugs to rest. That may be beneficial. Comfortable bedding. So it's said that some fabrics like polyester can actually trap in heats. And so it's recommended to use bedding that's made of cotton or linen that can be a little bit lighter and more comfortable. And then also having a comfortable mattress. So if your mattress is older than 7 years old, it may be time to get a new mattress, and it may be worth it for a full night's rest. Technology. So while we all like to stay connected during the day and stay on our phones and devices, it's a big contributor to staying awake at night. I know personally when I lay down at night, I'm very bad about holding my cell phone and sending a couple more text messages. But in reality, it increases your alertness and keeps you awake. And you have that feeling of, oh, I'm just going to send one more text message, or I'm just going to play this game for 5 more minutes. And you end up staying up longer, and it messes with your sleep. It abrupts your sleep cycle. Now, if you've tried all of these and they're not working, it may be time to consider an herbal supplement. So I wanted to talk to you all about some herbal supplements that are available. Melatonin is probably the most popular of the herbal supplements, and we talked a little bit about how your body has a natural hormone called melatonin, which works the same way. So melatonin can help you fall asleep 5 to 9 minutes faster, and the big thing is that it's really well tolerated, so there's very little safety concerns with using melatonin, and so that's why it's recommended in a lot of different patients. While some of our herbal supplements may not have a lot of evidence to prove that they work well or that they are efficacious, as we call it, melatonin actually has some low to moderate evidence that it's helpful. And so you'll see as we go through some of the other herbal products that this may be more than some of the others. And it's important just to take it around bedtime because it can actually change your sleep cycle during the day. So if you were to take it in the afternoon, some people use it if they work at night and need to stay awake all night, they use it to help change their sleep schedule. Valerian is another medication that can be used. And mind you, with herbal supplements, these aren't FDA approved, so these are medications that are thought to be helpful. But it's thought to help you fall asleep faster. But again, studies don't really show that it has this benefit. It's generally well tolerated, so there aren't a lot of huge concerns. So if you find something that helps you, I would definitely recommend that you give it a try. What works well for one person may not work well for another. But overall, the biggest concern with it is that it can cause an increase in diarrhea. So if you are on a chemo regimen, say irinotecan, that has that side effect already, this may not be the best option for you. And then it does have some drug interactions. And so you'll hear me say this multiple times, but it's really important to always talk to your physician and your pharmacist before starting any of these new medications. Some other herbal supplements that are commonly seen. Chamomile is a tea that's been used for relaxation for centuries, and it's thought to help you relax and help you fall asleep. Studies haven't really shown that it helps in terms of time to falling asleep, duration of sleep, or quality, but again, it's well tolerated. There's not really any concerns with using it, so if it helps you, definitely go with it. Lavender is an aromatherapy, and it promotes relaxation also, and it has been shown to improve sleep quality. And there's no safety concerns with lavender, using lavender as an aromatherapy, so it's definitely something to try. Kava root, evidence is mixed in terms of whether it helps or not. It may improve sleep quality, but the big thing is that long-term use is not recommended with kava root because it's been shown to be associated with liver toxicity and harm to your liver. So it definitely would not be my first option. Over-the-counter medications. So, over-the-counter medications are typically our traditional antihistamine agents. And so I've listed the most common ones out here for you on the slide. So you'll see doxylamine, which is also Unisom nighttime, and then diphenhydramine, also goes by Benadryl, Sominex, Unisom, Z-Quil, and then there's combinations like Excedrin and Tylenol PM. We'll talk a little bit more about those. So these medications, as I mentioned, they're all antihistamines, and even though they all look very different by the boxes, it's important to know that they all work the same way. And so it's important not to double up or try more than one of these agents. If you're going to try one, to just stick with one. And what they do is they block a natural chemical in your body called histamine. And histamine is typically the chemical that causes an allergic response in your body. So these medications were traditionally made to help with allergic reactions or allergic symptoms. But interestingly enough, they actually, by their structure, can get into your brain and affect your sleep cycle. And that's why we're able to use them to help with sleep. They have a lot of limitations, as you'll see on the slide. So there's a lot of side effects that come along with these type of agents. So you'll see confusion, dizziness, dry mouth, constipation. You might have difficulty urinating, blurry vision, increased heart rate, daytime sleepiness. So you might feel groggy the next morning, and that feeling may have not worn off completely. They also can wear off with continued use. So if you use them longer than 4 days, the effectiveness of them can actually start to wear off and they won't work as well. They also change the type of sleep that you get. So they can actually make it so that you get less of that REM sleep that we talked about and affect your sleep cycle in that way. They're also not recommended in every patient. So if you have asthma, some types of glaucoma, pulmonary disease like COPD, prostate hypertrophy or an enlarged prostate, and also our elderly populations, we really don't recommend these medications. And overall, I would say that antihistamines are not our preferred agents with sleep.
May I ask a quick question?
Sure.
So regarding the elderly population and the list of these drugs, yeah. So they are probably still recommended if you do have an allergic reaction for something, but they're not recommended for sleep. Is that?
Well, we have some other agents that can be used for allergic reactions as well, so it depends on the patient and their situation. But I'll mention it a little bit later, but there are definitely circumstances where those patients would need to take these medications.
Okay.
But it's not typically our first choice unless we have to go to them.
Very interesting.
So with the allergy medicines, what about the Claritins and the other?
Yes, so those are the other medications I was referring to. So those medications actually don't cross into the brain quite as well and can actually not cause that same level of drowsiness.
That's why they're preferred for allergies, because you don't want to be sedated during the day and everything. So now people pretty much take Claritin, Zyrtec, or Allegra because they're less sedating.
Okay.
I have some elderly people in my life who will always keep Benadryl in their medicine cabinet, so that was very nice.
Occasionally use it's okay, but like day in, day out, especially in the
Yeah.
elderly population, you want to avoid it.
Oh, good to know.
And so this kind of goes back to that with saying there's that common misconception that if a medication can be bought over the counter and you don't need a prescription for it, that it can't cause harm. And that's completely false. Because in fact, these medications can cause harm and do cause harm when used in the inappropriate setting. And they have drug interactions with other medications. And they're not appropriate in all patients with all conditions. So as I mentioned before, it's very essential that if you feel the need to start one of these agents, that you first have the conversation with your physician or your pharmacist at least to talk about some of the other things you have going on and make sure that it's the appropriate choice for you. Now you've tried all of these, and now it's time to move to a prescription medication. And some of these actually apply to some of the over-the-counter medications that we talked about as well. But I want to go back to saying there's different types of insomnia. So you may have the issue of falling asleep. or you may be the person that has the issue where you wake up 4 times during the night, or you may not be able to sleep long enough. So those all play into how we choose the agent that we're going to use to help with sleep. So in our perfect setting, in our perfect world, our ideal sleep medication would have a rapid onset, which means it would help you fall asleep quicker. It would be used to fall asleep. And that being because if you have a medication that takes hours or days to kick in, obviously it's not going to work to help you quickly when you need it to fall asleep. We'd also like our medications to work for a really long time, for 6 to 8 hours, because that's the time that we're going to be asleep. So if we take one of these medications and it wears off in 3 hours, that may not help you if you're this person that needs help staying asleep during the night. So we'd want our medication to have that. We'd want our medication to have minimal side effects. We like all our medications to have minimal side effects. But to be quite honest, that medication doesn't exist. So we also talked about how some of these medications can change the structure of your sleep and the type of sleep that you get. And so we don't want that to happen. We'd like our sleep structure to be preserved, and we'd like to get the same amount of light, deep, and REM sleep during the night, regardless of the medication we're taking. We definitely don't want our medication to be addictive or have any withdrawal symptoms. We don't want to build tolerance to it, so we would like it, if I was going to take it forever, I would like it to continue working, and I'd like it to always help me fall asleep and stay asleep. And then we also don't want it to have any drug interactions. So we want a medication that doesn't interact with any of the other medications that I'm taking for blood pressure or diabetes or any of my other conditions. Given that, these are the medications that we really have, and these are the most common ones that we use. So benzodiazepines, or benzos, you might notice as having names like Halcyon or Restoril. These are our common benzos. We also have Z drugs, which are non-benzodiazepine drugs, which go by Ambien or Lunesta. We have antidepressant agents that we use, like Remeron or mirtazapine, trazodone, or amitriptyline, Elavil. And then we also can see Bremeltion used. So these are our benzos. And so I've listed out for you here the benzodiazepines that are FDA approved to help with sleep. But the benzos that you may be more familiar with are maybe the ones that are used to treat anxiety, like Xanax or Ativan. Those medications work the exact same way. And so these medications work by enhancing a chemical in your body or in your brain that helps you relax and helps you sleep. And so they have been known to help with reduced time to sleep, so they can help you fall asleep quicker and increase your total time of sleep. However, they can affect your sleep structure, so they can make it so that you get less of that deep sleep, that stage 3 and 4 sleep that can be very important. All of these medications are effective and work, but the way that we differentiate between them and choose is because they vary in their time to start working, their time to onset, the duration that they work. They differ in cost, and also their interaction profiles with some of your other medications. Benzos, like some of the other meds that we talked about, have a lot of limitations. And so one of them is that they are considered controlled substances. And what it means to be categorized as a controlled substance is that it has the capacity to be used, to be misused, or abused. So that's what categorizes it that way. These medications should also be avoided in patients with alcohol use because they can work similarly to alcohol and can kind of work doubly to sedate you and cause some of the bad effects of alcohol. They shouldn't be used in pregnancy, so they can actually have been known to cause birth defects if a woman takes it while pregnant. They are to be avoided with sleep apnea or respiratory disorders or lung disorders. It can be problematic. And then they also have a lot of side effects. So they can cause some of that daytime cognitive impairment and sedation, daytime sleepiness, so that grogginess that lasts into the next day, insomnia rebound, which we'll talk a little bit more about. And then you can get some amnesia with some benzodiazepines, which I think is an interesting side effect because this doesn't mean that you forget the past, or but it basically the type of amnesia that occurs with benzos is that you can sometimes have trouble with making new memories. And so that's a unique fact about benzos. And then it can also slow breathing rate down. So, and this is important to mention if you're taking other medications that can do the same things. So if you're taking pain medications like opiates, this can be deadly, quite honestly, if taken inappropriately. So it's very important, again, to have that conversation and make sure that the medications you're on are appropriate. So our non-diazepine, benzodiazepines, or Z drugs as we refer to them as, they also have a quick onset. However, they're thought to not affect our sleep cycle, so they shouldn't affect the amount of deep sleep that you get. They should still be avoided with alcohol, sleep apnea, and pregnancy for the same reasons as benzos, because they work the same way as benzos, essentially. And so these are medications like Ambien, Lunesta, Sonata, and they improve sleep onset and sleep duration. But some of the things that distinguish them are Sonata can actually help with sleep awakening. And the reason for that is because it has a shorter duration of action, as you can see there. It works for about 3 to 4 hours, then it kind of wears off. So what that means is if you have trouble with sleep awakening and waking up in the middle of the night and having trouble falling back asleep, there's a potential that you could take this medication again to help you fall back asleep, where that would not be appropriate in a medication that takes over 7 hours to wear off and is still active in your system. Another thing is that there's a recommended maximum lengths of use. So it's recommended that you don't use Ambien or Sonata for longer than 1 month, whereas Lunesta can be used for up to 6 months of duration. There's also different side effect profiles that occur with them. As a whole, they can cause that dizziness, headache, increased risk of falls. But some that stand out, Lunesta can also cause unpleasant taste and dry mouth. And then Ambien can, again, cause some of that amnesia we talked about before and upset stomach. And something that's unique about Ambien that's been seen is that it's actually, patients have been seen doing sleep-related activities on Ambien. And so there's been warnings about sleep eating, sleep driving, sleep telephone calling. And so that's something that's very interesting about Ambien. Both benzos and Z drugs can both be associated with tolerance, withdrawal, and dependence. And what that means is tolerance. If I'm continuing to take this medication every single night, the effects are going to decrease in the time of 1 to 2 weeks. So they're not going to help quite as much. And if the medications aren't helping as much, I'm likely to go to my physician and say, hey, I think I need an up or an increase in my dose, or I need another medication. This just isn't working as well for me. And as you can imagine, this ultimately leads to increased dosages of these medications, which leads to increased side effects that we talked about. And so the recommendation is really to use these intermittently, so 2 to 3 nights max. But if you have to use it longer, definitely you shouldn't use most of these agents for longer than a month. Now withdrawal. So if I'm taking these medications every single day and then I decide I'm not taking them anymore and I abruptly stop taking them, I can actually have withdrawal symptoms from these medications. And that can mean anxiety, cramps, nausea and vomiting, sweating, sensitivity to light or photophobia, tremors or shakiness, seizures can occur, irritability and headache. And then you can also have that rebound insomnia, which means that if I stop taking it all of a sudden, it's actually going to make for increased wakefulness and I'm actually going to have trouble falling asleep. So you can see how this could be problematic. And these medications, if you decide are not appropriate for you anymore, if you've been taking them regularly, what needs to be done is that you'd have to go to your physician and be what we call tapered off of them. So they'd have to slowly decrease the dose over time to avoid you having these symptoms. And knowing that it has these withdrawal symptoms, you can imagine how it can be difficult for many patients to come off of these medications once they start them. And so that leads to dependence. And basically, all of these medications can ultimately lead to dependence and misuse, and should be avoided in all patients that have a history of drug dependence that have happened in the past. Another agent we can use to help with sleep are antidepressants, which I touched on before. Again, it depends on the antidepressant because some may be activating and keeping awake, but there's a couple here specifically that I've pointed out that we actually sort of use their side effect of drowsiness to help with our sleep conditions. We typically use these at a low dose, so not really at the high doses that we're using for depression. And However, this could be a good option in patients who have depression, and we talked about before that insomnia can be a sign of depression. So if we're treating that depression in some patients, it may also improve sleep that way. Some of our older antidepressant agents tend to be associated with more side effects, and you'll see that when I touch on amitriptyline. And they can interact with some of your other medications. They can all have interactions with other medications. But the first one I wanted to mention is mirtazapine or Remeron. That can be used commonly. However, its limitations are that it can cause weight gain, which is definitely not ideal in all patients, and can also cause things like increase in cholesterol, which may be problematic if you have a history of heart disease or diabetes or other conditions. Trazodone has some side effects such as dry mouth and nausea, can cause some grogginess in the daytime, dizziness and headache, but it is commonly used at low doses. And then amitriptyline is one of our older antidepressant agents and is associated with low blood pressure upon standing. So if you take this medication and you stand up quickly, you could feel very dizzy, which could increase your risk of having falls. Can also lead to blurred vision, dry mouth, confusion, and poor coordination, which you can imagine is problematic in an elderly population that's already at an increase of falls. And the last medication that I wanted to touch on is Remeltion. And Remeltion works much like our body's natural melatonin or like the herbal supplement melatonin. However, it's thought to have a longer duration and work a little bit longer. And so it's a prescription medication. It does help with falling asleep and can be effective for up to 6 months. This medication overall is pretty well tolerated. It can cause some sedation and dizziness, nausea, like many of the agents that we talked about, but overall it seems to have a little bit safer profile than some of the others we talked about. And some of the big benefits of it are that there's no reported daytime effects, so you don't have that grogginess in the morning. We haven't seen rebound insomnia or withdrawal with this medication. And so I listed out all of the common medications that we use for sleep, but I wanted to point out this recommendation by the American Geriatric Society, which puts out a list annually is what we refer to as the Beers list. And they might make recommendations for patients over 65 years of age in terms of medication. And what they say is that in our patients over 65, we should avoid diphenhydramine, which is Benadryl, doxylamine, which is our other antihistamine agent, benzodiazepines, Z-drugs, and amitriptyline. And they say we should avoid mirtazapine or Remeron. So really, that's half our list already, right? So we don't really have a lot of agents that are really great to be used in these patient populations. Some of the things we can consider are melatonin, which is definitely something that may be less harmful to the patient. We may consider Remeltion and other medications, but we are definitely very limited. And at times, we are so limited that we have to use these medications. But if we do so, we do it at the very lowest dose, because this patient population can have the same side effects, but exacerbated and worse than our average patient. And they can cause confusion, sedation. And overall, these medications as a whole can increase risk of falls, which is very concerning in our elderly population. So overall, I wanted to give you a summary of kind of what would happen if I couldn't sleep. The first thing we're going to want to look at is avoiding contributing factors. So we already talked about this may be tackling what is keeping you awake. So if it's pain that's keeping you awake, maybe we need to work on better pain control. So we're going to avoid contributing factors first. If that doesn't work, we need to take a look at sleep habits. Remember that sleep habits can have improved in 70 to 80% of patients without medications and can definitely make an impact in a patient's life. If those don't seem to be working, it's time to see your physician, because remember, you have to have that conversation. So we need to have the conversation of what's appropriate and what we can do differently with your physician. At that point, he may decide to tell you to try some over-the-counter medications or some herbal products. And if those don't work, they move on to prescription medications. Something else you can do is keeping a sleep diary. So this is thought to be helpful in assessing how well you're sleeping, and also what's helped and what hasn't helped. And so it can be helpful in terms of communicating with your physician as well. But it's good if you've made a change to your regimen or you've tried a new medication to keep this diary and evaluate it after about a week of this new change. And so you're going to want to record what time you went to bed, what time you woke up, how long it took you to fall asleep, the number of times during the night that you were woken up, the number of naps you took that day, and then also write down like what did you remember to take your medications that day? Write that down if you missed a medication, because that can impact how well do you think the medication helped when you took it, and did you have any side effects? These are all good things to write down. That way when you next meet with your physician, you can give them the full picture. And then lastly, I wanted to highlight some different applications you can download on your phone, which may or may not be useful to you, but it may be something to check out if you're having concerns with sleep. So the Sleep Cycle app is interesting. It actually kind of tracks your sleep cycle during the night, and you can set it to alarm and wake you up at a time that's during your light sleep, and so that it makes you less groggy when you wake up. Relaxed melodies can kind of give you can kind of help with the has music and things that help you stay asleep that may or may not be helpful for you. Pillow tracks different data of your sleep during the night, and it's supposed to track your movements during the night and give you reports at the end. And then Sleep Time also works similarly to Sleep Cycle, where it kind of is supposed to wake you up at the appropriate time during the night or in the morning. And so overall, insomnia can definitely greatly impact any person's life and their quality of life. We talked about the impacts it can have on your health. And patients that have other health conditions like cancer are definitely at a higher risk of having these sleep disturbances and insomnia. It's important to learn what factors are contributing to your sleep loss so that we can tackle those first. Then when we move on to medications, it's important to know that medications can benefit you but are also always associated with risks as well. And then again, always discuss all of this with your physician before making changes. And then that's all I have for you. Thank you all.
Thank you. Very good.